So a common question is, how long does it take to heal from this surgery? I'm Dr. Albert Park, the prosthodontist here at Nuvia in Dallas, and today we're going to talk about healing and dental implants. Right after surgery, the soft tissue itself will take approximately 7 to 10 days to close. To help that healing process, we have dissolvable sutures, and underneath those sutures, we also use what's called PRF. We take the patient's own blood, we put it into a test tube and centrifuge. And the centrifuge basically separates the particles that are the heaviest to the bottom, so that'll be the red blood cells. And on the top, you'll be left with a off-white yellow material. That's all the healing factors. And so what we'll do is we'll take that portion of the test tube, flatten it. When you flatten it, it becomes a membrane that'll help with the healing process, loaded with platelets and a lot of healing factors that'll help the soft tissue close up as quickly as possible. And so again, the soft tissue itself will take approximately 7 to 10 days to fully close. So after the soft tissue is closed, most of the additional healing will be underneath the tissues. So the bone and the implant themselves will go through several months of healing to the point where you have osseointegration. Osseointegration is the process of the titanium implants getting integrated with your own bone. That can take 2 to 4 months. So part of the healing process is the bone and the tissue around the implants will remodel, and the majority of the soft tissue and hard tissue changes will be in the first 5 months. It's also very important that we take in consideration your medical history. If there are any pre-existing conditions such as high blood pressure, diabetes, those things will play a role in terms of the healing process as well. For those patients that do have diabetes, the healing process is not as optimal, and so it's very important that we remain in contact with your primary care physician and make sure that the diabetes is under control. So if you're a smoker or a vapor, yes, the healing process will be slowed down if you are actively smoking. I would recommend stop smoking, but I understand it's a very difficult habit to kick. What happens is when you have that hot smoke, and even vapes that's not hot smoke, the smoke itself will constrict the blood vessels in the soft tissue. So it's very important that if you are a active smoker or a vapor, try your best to stop. So there's one unsung hero that'll help with the healing process, and that is the night guard. The night guard must be worn every night. It's going to help protect the prosthetic and protect the implants. It's very important because if you have your teeth extracted, subconsciously when you're sleeping, you're going to be clenching and grinding. Especially in patients that had no teeth prior to this procedure or maybe only had half their teeth. And so now you have a full set of teeth, upper and lower. Subconsciously when you're sleeping, you're gonna be clenching, you're gonna be grinding because your body's like, hey, what is this in my mouth? And so that is the reason why it's very important that you wear the night guard, because you will be clenching, you will be grinding, just because your body's curious. They wanna know exactly what's in your mouth and what's going on. And so wear that night guard, protect that prosthetic, protect the implants. You wanna learn more about dental implants? Click here.